Welcome to the Deep Dive. You know, we hear so much about mindfulness these days, especially digital tools, apps on our phones promising to make us calmer, happier.
That's right. It's everywhere.
Right.
But the question is, does it actually, work?
Yeah.
Especially these short app-based things.
Exactly. So today we're doing a deep dive into exactly that. We've got a scientific paper, a proper study from the British Journal of Health Psychology, and also a news article that sums it up.
And it's a pretty significant study looking at whether these quick, accessible mindfulness practices really move the needle on our mental health and even how we think about our health behaviors.
Right. So our mission today is to unpack this research and see what it tells us. Can 10 minutes a day on an app make a difference?
Let's get into it. The core of this is what's called a randomized controlled trial, or RCT. Basically, the gold standard for figuring out if an intervention works.
Okay, so they set up a proper experiment. Who was involved?
Well, this is one of the impressive parts. They recruited participants from, get this, 91 different countries.
Wow, 91. That's huge.
Yeah, over 1,200 people initially. The average age was about 27, so a pretty broad international group.
And what did they actually do in this trial?
They split them into two groups randomly. One group got the mindfulness intervention. They used a free app called Medito for 10 minutes every day for 30 days.
Medito. Okay. What kind of mindfulness?
It was guided stuff, things like relaxation techniques, setting intentions, body scans, focusing on the breath, and a bit of reflection time. Fairly standard mindfulness practices.
10 minutes daily for a month. Seems doable. What about the other group? The control group?
Right, the active control. This is really smart. They also use the Medito app for 10 minutes a day.
Oh, okay. Doing the same thing.
Not quite. Instead of mindfulness, they listened to audiobook excerpts, specifically Alice's Adventures in Wonderland and Through the Looking Glass.
Alice in Wonderland. Interesting choice.
Well, the point was to have them doing something engaging for the same amount of time, using the same app interface. It helps make sure any differences seen aren't just because one group spent 10 minutes doing anything on an app versus nothing. It isolates the mindfulness component.
Ah, I see. That makes a lot of sense.
Yeah.
Controls for the novelty or just the act of listening. So what were they measuring? How did they know if it worked?
They looked at a few key things, psychological well-being, just general positive mental health, also specific symptoms, depression, anxiety, and stress levels, and sleep quality too.
And they measured these when?
At the start, so baseline.
Yeah.
Then right after the 30 days post-intervention. And crucially, they did a follow-up 2 months after the study ended to see if effects lasted.
2-month follow-up. Good. Anything else?
Yes. They also measured what they termed health behavior cognitions, which is basically a fancy way of saying how people think about health behaviors.
Like what kind of thoughts?
Things like self-efficacy, do you feel confident you can do healthy things? Self-regulation, can you stick with it? Your attitudes towards health, social norms, perceived control, and importantly, your actual intentions to look after your health.
Okay, so they looked at both how people felt and how they thought about taking care of themselves. Seems very thorough.
Definitely. And those strengths you mentioned earlier, the international reach, the large initial sample size, they really stand out.
Yeah, that global aspect is pretty unique.
Absolutely. Plus, the intervention itself is super accessible. A free app, just 10 minutes. That's a big plus. And the 30-day period feels practical, not some huge commitment.
And that active control group, as we said, that really boosts the study's credibility, doesn't it?
It really does. It adds a layer of rigor you don't always see.
Okay, so the big question then, what did they find? Did the mindfulness group actually fare better psychologically after 30 days?
Yes, they did. Significantly so, actually. Compared to the Alice in Wonderland group, the mindfulness group reported higher psychological well-being.
So they felt better overall.
Exactly. And they also showed lower levels of depression symptoms and anxiety symptoms right after the intervention.
Okay, that's promising. What about at the 2-month follow-up? Did those benefits stick?
Well, yes and no, partly. The improvements in psychological well-being and the reduction in depression symptoms, those were still significantly better in the mindfulness group 2 months later.
That's great persistence.
It is. And interestingly, sleep quality also showed up as significantly better for the mindfulness group at that 2-month mark, even if it wasn't significant right after the 30 days.
Better sleep long-term. That's a big one for many people. What about stress?
That's the interesting bit. They didn't find a significant difference in stress levels between the groups, either immediately after or at the follow-up.
Huh. So improvements in well-being, depression, anxiety initially, and sleep later, but not stress.
Yeah, it's a nuanced picture. Now, shifting to those health cognitions, how people thought about health.
Right. Did the mindfulness change their thinking?
It seemed to. At the 30-day point, the mindfulness group had more positive attitudes about maintaining their health. They felt they had more control over their health behaviors and stronger intentions to actually do healthy things.
So more motivated and confident about health.
Seems like it. They also reported feeling less perceived social pressure or expectation around health, which is kind of interesting.
Less pressure. And did those cognitive changes last?
Some did. At the 2-month follow-up, the mindfulness group still showed greater what they call autonomous self-regulation, basically, feeling more internally driven to be healthy. And they maintained those more positive attitudes towards health maintenance.
So it looks like the mindfulness wasn't just affecting mood, but also potentially shifting underlying beliefs and motivations about health.
That's exactly what the researchers suggest. They actually found that these changes in health attitudes and intentions partially explain the improvements in psychological health.
So the way people started thinking about health might have been why they felt better psychologically, a potential mechanism.
Precisely. It suggests that practicing mindfulness might help reshape those internal beliefs, which then feeds into better well-being.
And all this achieved through a free digital app. That feels significant.
It really does. It points towards digital mindfulness being a potentially effective and obviously very scalable tool for the general population. It gets around barriers like cost or needing to attend sessions in person.
Makes mental wellness tools potentially much more accessible. But okay, no study is perfect. You mentioned rigor, but were there any catches? Limitations?
Yes, and this is a pretty major one, actually. The dropout rate, it was high.
High how?
Well, remember, they started with over 1,200 people. Only about 300, roughly 24%, completed the measurements right after the intervention.
Oof, that's a big drop.
And it got lower. Only about 200, just over 16%, completed the 2-month follow-up.
Wow, okay. Less than 1 in 5 made it all the way through. What does that mean for the results?
It means we have to be cautious. This is a classic issue in these kinds of online intervention studies. The people who stick with it might be different from those who drop out.
How so? Did they check that?
They did. They found that the people who dropped out were more likely to be younger and, perhaps crucially, have less previous meditation experience.
So the positive results might be coming more from people who are already inclined towards meditation or perhaps found it easier to stick with.
Exactly. It's what researchers sometimes call survivor bias. The findings might represent the maximal effect, what happens for people who engage well, rather than the average effect you'd see if everyone stuck with it.
That's a really critical caveat. So the positive results are real for some, but maybe not representative of everyone who tries it.
Precisely. And related to that, this was a self-selected general population sample. They generally had low levels of mental health symptoms to begin with, meaning we can't automatically assume these results would apply to people with diagnosed clinical depression or anxiety disorders, for example. Their needs and responses might be very different.
Right, not a clinical trial for treatment.
Correct. And one other point linked to the dropouts, while the study didn't measure adverse effects directly, it's possible some people dropped out because they didn't like the practice, found it unhelpful, or maybe even felt worse. We don't know for sure from this data, but it's a possibility to keep in mind with any intervention.
Okay. So pulling it all together.
Yeah.
It seems like even these short 10-minute daily mindfulness sessions on a free app can positively impact well-being, depression, anxiety, and maybe even sleep, potentially by shifting our attitudes and intentions around health.
Yes, that seems to be the main signal from the data.
And the strengths are clear, big international sample, easily accessible tool, good design with the active control.
Absolutely. Strong points.
But that high dropout rate is a major flag. It really tempers how broadly we can apply these findings, suggesting the positive effects might be strongest for those who are already motivated, or perhaps a better fit for this kind of practice. And definitely need caution applying it to clinical groups.
That sums it up perfectly. It's promising, but with important asterisks.
So for you listening, it kind of leaves you thinking, doesn't it?
Yeah.
Given how easy it is to access something like this 10 minutes on a free app,
Yeah.
is it maybe worth exploring for yourself?
But keeping in mind, as the study hints, that experiences can really vary from person to person. What works wonders for one might not click for another.
Definitely. And it makes you wonder, what else about this intersection of digital life, apps, and our mental well-being deserves a closer look? Something maybe to think about after this deep dive.